I'm going to do a peer checkoff video for inserting a nasal airway and then doing the sterile nasotracheal section. So first you come in, you introduce yourself to your patient and introduce your department. You let them know what you're going to be doing. You assess them, you take their vital signs. Before we do this particular process, we make sure we hyperoxygenate the patient so that they're going to be able to withstand the procedure. So I went ahead and I've already found the correct size of nasal airway for my patient. I've hyperoxygenated them. I've washed my hands. Get gloved up here quickly, and then we're going to go ahead and insert the nasal airway. So to do that, we're going to use just a little bit of this water-soluble lubricant. Put just right into the palm of the hand, and then I'm going to run it through the palm like this. Okay, and then the baffled side needs to go toward this, the septum, and so I'm going to go ahead and insert the nasal airway. Just turn it a little bit. If you meet resistance, don't push. Okay, so now that we've got the airway in, we are ready to start the process of the suction. So to do that, we need to open our sterile catheter suction kit. So I'm going to go ahead and put on my sterile gloves. They're folded over, so you just kind of insert the hand. Okay, and then they're on. So this is going to be my clean hand, and this will be my sterile hand. So I'm going to go ahead and I've filled my basin full of sterile saline, and I'm going to go ahead and hook my suction up to my catheter up to the suction. And so for an adult, it's -120 to -150. For a child, it's -80 to -100. So then to test that, I'm going to go ahead and insert the end of the catheter into the sterile saline and occlude the thumb port to make sure that my suction is working properly, and it is. So I'm going to go ahead and put the lubricant on my catheter. Okay. I'm going to wrap it around my hand. And I'm going to insert the catheter until I get into the patient's trachea, and I'll be able to see that on condensation on the inside of the tubing, as well as my patient may cough. And then once we get there, we're going to just slightly pull back. We're going to occlude the thumb port, or we're going to suction out. Okay, that process should take less than 15 seconds. And then I'm going to go ahead and dispose of the nasal catheter. With my non-sterile hand, I'm going to re-oxygenate my patient for at least 1 minute. And I'm going to reassess them. I'm going to check their SpO2. I'm going to check their vitals. I'm going to check their respiratory rate and pattern, because I need to make sure that they're doing okay after the suction. Okay, for this patient, I'm going to go ahead and leave my nasal airway in place, because we're going to be coming back again to suction, and the less amount of times that we have to insert the nasal airway, the less trauma that we're going to create in that airway for him, or in that nair. So we're going to leave the airway in. And then I'm going to just make sure that he's comfortable. Does he need anything? Does he have any questions? And if not, I'll just let him know that I'll be back later.